Depression. What is depression? Everyone occasionally feels blue or sad, but these feelings are usually short-lived and pass within a couple of days. When you have depression, it interferes with daily life and causes pain for both you and those who care about you. Depression is a common but serious illness. Many people with depressive illness never seek treatment, but the majority, even those with the most severe depression, can get better with treatment. Medications, psychotherapies, and other methods can effectively treat people with depression. There are several forms of depressive disorders. Major depressive disorder, or major depression, is characterized by a combination of symptoms that interfere with a person's ability to work, study, sleep, eat, and enjoy one's pleasurable activities. Major depression is disabling and prevents a person from functioning normally. Some people may experience only a single episode within their lifetime, but more often a person may have multiple episodes. Dysthymic disorder, or dysthymia, is characterized by long-term, 2 years or longer, symptoms that may not be severe enough to disable a person, but can prevent normal functioning or feeling well. People with dysthymia may also experience one or more episodes of major depression during their lifetimes. Minor depression is characterized by having symptoms for 2 weeks or longer that do not meet full criteria for major depression. Without treatment, people with minor depression are at high risk for developing major depressive disorder. Some forms of depression are slightly different, or they may develop under unique circumstances. However, not everyone agrees on how to characterize and define these forms of depression. They include psychotic depression, which occurs when a person has severe depression plus some form of psychosis, such as having disturbing false beliefs or a break with reality, which are delusions, or hearing or seeing upsetting things that others cannot see or hear, which are hallucinations. Postpartum depression, which is much more serious than the baby blues that many women experience after giving birth, when hormonal and physical changes and the new responsibility of caring for a newborn can be overwhelming. It is estimated that 10 to 15% of women experience postpartum depression after giving birth. Seasonal affective disorder, or SAD, which is characterized by the onset of depression during the winter months when there is less natural sunlight. The depression generally lifts during spring and summer. SAD may be effectively treated with light therapy, but nearly half of those with SAD do not get better with light therapy alone. Antidepressant medication and psychotherapy can reduce SAD symptoms either alone or in a combination with light therapy. Signs and symptoms of depression are persistent, sad, anxious, or empty feelings, feelings of hopelessness or pessimism, feelings of guilt, worthlessness, and helplessness, irritability or restlessness, loss of interest in activities or hobbies once pleasurable, including sex, fatigue and decreased energy, difficulty concentrating, remembering details, and making decisions, insomnia, early morning wakefulness or excessive sleeping, overeating or appetite loss, thoughts of suicide, suicide attempts, aches or pains, headaches, cramps, or digestive problems that do not ease with treatment. Some causes of depression are usually a combination of genetic, biological, environmental, and psychological factors. Depressive illnesses are disorders of the brain. Brain imaging technologies such as magnetic resonance imaging, or MRIs, have shown that the brains of people who have depression look different than those of the people without depression. The parts of the brain involving the mood, thinking, sleep, appetite, and behavior appear different, but these images do not reveal why the depression has occurred. They also cannot be used to diagnose depression. So who's at risk for depression? Major depressive disorder is one of the most common mental disorders in the United States. Each year, about 6.7% of U.S. adults experience major depressive disorder. Women are 70% more likely than men to experience depression during their lifetime.
I'm done.
Video. How do women experience depression? Depression is more common among women than men. Biological, life cycle, hormonal, and psychosocial factors that women experience may be linked to women's higher depression rate. Researchers have shown that hormones directly affect the brain chemistry that controls emotions and mood. For example, women are especially vulnerable to developing postpartum depression after giving birth, when hormonal and physical changes are the new responsibility of caring for a newborn that can be overwhelming. Some women may also have a severe form of premenstrual syndrome or PMS, called premenstrual dysphoric disorder, which is called PMDD. PMDD is associated with the hormonal changes that typically occur around ovulation and before menstruation begins. Finally, many women face the additional stresses of work and home responsibilities, caring for children and aging parents, abuse, poverty, and relationship strains. It is still unclear, though, why some women faced with enormous challenges develop depression, while others with similar changes do not. So how do men experience depression? Men often experience depression differently than women. While women with depression are more likely to have feelings of sadness, worthlessness, and excessive guilt, men are more likely to be very tired, irritable, lose interest in once pleasurable activities, and have difficulty sleeping. Men may be more likely than women to turn to alcohol or drugs when they are depressed. They also may become frustrated, discouraged, irritable, angry, and sometimes abusive. Some men throw themselves into their work to avoid talking about their depression with family or friends, or behave recklessly. And although more women attempt suicide, many more men die by suicide in the United States.
Depression can produce various problems that may affect working life, like in difficulties with concentration, decision-making, and memory, excessive anxiety and lack confidence, disruption of working relationship. People who are affected by depression also have a raised risk of suicide. This applies to all age groups, from children to adolescents to the elderly age. Treatment. Once diagnosed, a person with depression can be treated in several ways. The most common treatments are medications and psychotherapy. Medications are antidepressants primarily work on brain chemicals called neurotransmitters, especially serotonin and norepinephrine. The TCAs are the older antidepressants. They are powerful, but they are not used as much today because their potential side effects are more serious. They may affect the heart in people with heart conditions.
A little bit, yeah.
Monoamine oxide inhibitors are the oldest class of antidepressant medications. They can be especially effective in case of atypical depression, such as when a person experiences increased appetite and need for more sleep rather than decreased appetite and sleep. Psychotherapy treatment is several types. There are several types of psychotherapy treatment, like talk therapy and cognitive behavioral therapy. The two main types of psychotherapies is cognitive therapy and interpersonal therapy. They are effective in treating depression. The cognitive behavioral therapy helps people with depression restructure negative thoughts patterns. Doing so helps people interpret their environment and interactions with others in a positive and a realistic way. I may also help you recognize things that may contribute to the depression that help you change.